Scoliosis is the three-dimensional side curvature of the spine, and often it shows up when you reach teenage. Before we move to the scoliosis, we'll look at the natural curvatures of the spine. So our spine has four major curvatures, two concave and two convex. The cervical lordosis, thoracic hyposis, lumbar lordosis, and sacrococcygeal hyposis. So everyone, we do have a small side curvature, but not every curvature considered to be a scoliosis. So the curvature more than 10 degree only considered to have a scoliosis. So scoliosis curvatures of the spine, we can divide it into two. One is the S curve. Here there are going to be two curves in the spine. So one curve going to be a concave, the other one going to be a convex, like in S shape. The other type of scoliosis is the C curvature scoliosis, which means only having a single curve in the spine, like in the shape of C. We can divide the scoliosis into a functional scoliosis and structural scoliosis. So functional scoliosis, there is no defect in the spine. So it's going to be a compensatory curvatures of the spine due to some imbalance in the body. Reasons for functional scoliosis. The first one is a leg length discrepancy. When there is a differences in the leg length or the limb length, that's going to create an imbalance in the hip. To manage the leg length discrepancy, one hip goes up than the other, which create a small scoliosis. Second one is a lateral pelvic tilt. Means that one hip is little higher than the other, secondary to a weak hip muscles. To balance the hip, the spine also curves to one side, and that leads to a scoliosis to develop. Third one is a surgery or scar on one side body, especially after abdominal surgery or a spinal surgery. That particular side muscles are getting weaker and become shortened in length. That creates a small imbalance in the spine, and the spine starts to curve to one side. Structural scoliosis. So it is a true scoliosis. There should be a direct defect in the spine. For an example, having a wedge vertebrae means that the vertebral body on the right and the left side are not even. So one side becomes thinner than the other. To compensate this, the spine itself have to turn to one side or lean to one side. So these kind of a small defects you can check through an X-ray. Signs and symptoms of scoliosis. So there should be a visible curve in the spine. There should be an unevenness of the shoulders, means one shoulder a little higher than the other. There should be some imbalances or unevenness in the hips. Again means that one hip is a little higher than the other. And there should be some protruding shoulder blades, protruding rib cage as well. And most of the people who are having scoliosis complaining of multiple joint pain, especially neck pain, mid-back, lower back, hip pain, and some people complaining of knee and the ankle joint as well. Depends on the severity of the curvature, we can divide the scoliosis into three categories: a mild, a moderate, and the severe curvatures. A mild scoliosis means that the curvature should be 10 to 20 degree or less than 10 degree. The scoliosis has to be reduced or fixed with a specific selection of exercises. Moderate scoliosis. The curvature going to be between 20 to 40 degree. This category of scoliosis people have to do a proper rehabilitation under a good guidance. This rehabilitation can able to start as early as possible and sometimes have to do it until the age of 21. Some of them might need an extra sort of support, kind of wearing a brace to support the spine or to straighten them. Severe scoliosis. So severe scoliosis means the angle of curvature become more than 40 degrees. In this category of people usually have facing difficulties with breathing. Because of the high curvature, the lung capacity will be compromised. So this category of people are being managing with the scoliosis corrective braces. So the brace has to be wear for like 23 hours in a day. There are times with their other medical complication. This category of people are being recommended to do a spinal surgery to correct or fix their curvatures. Even this category of people also being recommended to do a spine stabilization exercises or strengthening exercises. From these exercises, the people are being expected to manage their symptoms as well as to control the curvature progress.